I am Dr. Philip Macmillan, and over the 5 years of the pandemic, I have always interviewed, asked questions, challenged narratives, because that's what science is about. One of the narratives that has come up through the pandemic is that everything that was done according to the standards that were set were perfect. Now, I ensure that whatever we do, we look at carefully and scientifically. Whenever we hear that there are so many lives saved across the world by vaccines and by interventions, it is very important that we look at outliers. One of the very important outliers is Haiti. Haiti had only 2.7% of their population vaccinated, with a relatively weak health infrastructure. Yet somehow, based on the statistics from the WHO, they may have had the best COVID outcomes in the world. Now, that may seem like a big statement. And you may say, well, why would I say this without any evidence when nobody believes that Haiti could do what they were doing? Well, what I've done is rather than just guess, as many people have done so far, I have sought to find someone who would be able to give us true, objective answers about what happened in Haiti. And the hope is that you listen to this, we learn, and we understand better the science around COVID-19. So without further ado, let's bring to the stage Jacob and Patrick. I'm going to ask Jacob if you could introduce yourself first, because you are an important piece of this puzzle to make sure we capture this information.
Sure.
Go ahead.
Yeah. So my name is Jacob. I grew up in Canada. I did a bachelor and a master in pharmacology there. And then after that, I moved to Denmark to reconnect with family and finish my PhD. My PhD's focused on clinical trials with psychedelics for mood disorders. We also do neural imaging. And then, as we spoke before, I grew up in Montreal, so I'm fully fluent in French and English. So I'm here to translate if needed for Dr. Deli.
Excellent. And Patrick, we really appreciate you coming to talk with us, but could you introduce yourself? And if you need to speak in French, Jacob is here to help guide us through slowly to hear, make sure we understand everything you're saying. So if you can go ahead, Patrick.
Thank you very much, Dr. Philip, for introducing me. I will try to introduce myself in English. My name is Patrick Deli. I'm from Haiti. I'm a physician. I'm a physician, a specialist in hygiene and epidemiology, a master in infectious disease and family doctor also. I work in the vigilance system in Haiti for more than 10 years. After that, I went to Madagascar to work in the FETP a program, field epidemiology training program, like a resident advisor. I just finished my contract now at April end. That is the reason now I'm in Montreal with my family. I can say I'm in vacation there. That is all about myself. I forget to say I was the director of the Directorate of Epidemiology Laboratory and Research in Haiti since 2018 to 2022.
So can I
Of that.
clarify that position, Patrick? So
Yes.
when you said you were the director, what exactly did that mean in the context of the COVID pandemic?
That means that I was in charge the all of the surveillance system in the country for the Ministry of Health or for the country. That was one, and also the president organized or create a scientific committee to make recommendation for the president, the prime minister about this epidemic. I was the coordinator, like the president of this committee. And then when we talk about the data in Haiti, I can say I was the first people who manage all data for the country, for the surveillance system, and also um, for the scientific committee for the country. I don't know if
Excellent.
it capped me. Mhm.
Yeah.
Over.
And so, Jacob, that sounds to me like we are potentially speaking with one of the most knowledgeable and senior people to give us information about the COVID strategy and pandemic. Would that be reasonable?
I mean, I would think so. You would think the director would take responsibility for the data collection and then what occurred during it. So, yeah, I would agree.
Good. I think that's important, Patrick, because as I said, my aim is to make sure that we have a robust scientific discussion, that anyone who is watching doesn't walk away thinking that the information we've gotten is partial. Okay. So, one of the first questions that people always say is that there is not a good health infrastructure in Haiti. What does that mean for the international community? What do we, how accurate is that? That's probably a better way of saying it.
Okay, I will answer in French.
Yes, go ahead.
Non, je dois dire que c'est
I
une
have to say,
c'est certainement le système de santé en Haïti,
certainly the
est,
health system is.
est précaire. Euh,
C'est
Toutefois,
quoi? Tu peux
le système,
répéter?
bon, je peux dire que le système de santé en Haïti est un système un peu faible.
It's a bit
Et,
weak.
Mhm. Cependant, en ce qui a trait au système de surveillance épidémiologique,
But our surveillance and epidemiology system,
je peux me vanter pour dire qu'on a un système très bien établi.
it's very
Euh,
well established.
et je m'explique. Après le tremblement de terre de 2010,
After the earthquake in 2010,
nous avons reçu un appui, je dirais, du gouvernement américain à travers
we received a
CDC
lot of support from governments, especially the Americans,
pour renforcer le système de surveillance et la direction d'épidémiologie des laboratoires et de la
to
recherche.
reinforce our systems, the surveillance system, and our epidemiology in general.
Et dans ce cas, on a renforcé le laboratoire
So we
et,
reinforced our labs
et habilité le laboratoire à être un laboratoire de référence, non seulement pour Haïti, mais dans la région.
and we made it a reference lab, not just for Haiti, but for the entire region.
Et parallèlement, nous avons formé beaucoup de cadres du ministère dans le domaine de l'épidémiologie de terrain à travers le programme
We
que
made
nous,
different divisions within the ministry,
à travers le programme que nous appelons programme de formation en épidémiologie de terrain avec
and we
l'appui
made
de
specific
CDC.
programs for epidemiology and monitoring.
Et ceci dit que depuis 2010, on avait un système de surveillance basé sur des sites sentinelles.
So we had Sentinel sites since that earthquake in 2010, and all the support we got, we were able to make Sentinel sites.
Mais avec le temps, notre système s'était transformé en un système presque exhaustif,
We had a very
c'est-à-dire
comprehensive system at the end.
un réseau national de surveillance.
We had a national network with national coverage.
Sur 1043 institutions du pays enregistrées dans le système de santé,
We had over 1,000 institutions that were part of this network.
à peu près 75% des institutions les plus importantes rapportaient au système en temps réel.
85% of these institutions were reporting to us in real time.
Ça veut dire que ce que nous avons comme système en Haïti, c'est vraiment un système bien monté et bien robuste avec des cadres qualifiés et avec une plateforme électronique qui nous permet d'avoir les
So
informations
our
en temps
system is
réel.
widespread and robust, and it's fully electronic, so we get almost real-time data.
Et pour venir à cette histoire de COVID, euh, je dois dire que moi-même, j'ai été la personne qui a implémenté le système de surveillance des infections
For
respiratoires
COVID, I
aiguës
implemented the
graves
surveillance system
en Haïti. Mhm. J'ai
in
implémenté
Haiti.
la surveillance des infections respiratoires aiguës graves en
I
Haïti
implemented the respiratory infection surveillance system myself.
depuis 2010 avec l'appui de la Banque mondiale, qui était un projet de préparation de réponse à une possible pandémie de grippe aviaire.
Since 2010, we had a lot of support also from the World Bank. They gave us a lot of funding and support to build and reinforce these systems.
OK. Maintenant, avec le renforcement de notre système, nous étions capables de
With the
surveiller les
reinforcement,
infections.
we were able to surveil.
Nous étions en train de réaliser la surveillance routinière des infections respiratoires,
We can do routine surveillance pretty commonly, pretty regularly,
incluant des examens de laboratoire.
including
Quand
lab
on,
exams.
quand on a annoncé les premiers cas de SARS-CoV-2
When we
à
announced the first
Wuhan, en
case,
Chine.
tu peux répéter?
Et à ce moment-là, en tant que directeur de la
And at that
direction
moment, as
d'épidémiologie,
director,
et la première chose que j'ai faite,
the first thing I did is
j'ai adapté le plan de surveillance des infections respiratoires aiguës
I made a plan to treat it as
à au nouveau problème qui se déroulait en Chine.
based on what was coming out of China already.
Avant même que l'Organisation mondiale de la santé ait déclaré cette
Even
maladie
before
comme
the
étant une urgence
WHO declared it.
internationale.
Could you repeat that, Jacob? You kind of spoke
Yeah,
over
he
each
was
other.
saying he did that even before, in advance of the WHO declaring it a pandemic or a problem.
OK. Nous
Yeah.
avons
Just pausing you a minute here, Patrick, because this is very important. So in effect, you guys probably had one of the most sophisticated surveillance systems in the Latin American region. Would there have been anybody else who had a better system in place prior to COVID than Haiti?
Est-ce que vous pouvez traduire pour moi? Pour que je...
Yeah, sorry, can you just repeat it one more time for me so I can get it
So,
clear?
would there have been any country in Latin America with a better surveillance system before COVID than Haiti?
OK. Ça semble que le système en Haïti était très avancé. Alors, il demande si il y a un autre pays à part d'Haïti qui a été plus avancé ou aussi avancé que Haïti.
Ce que je peux dire, je
What
ne
I
veux
can
pas
say.
dire, je ne veux pas dire que nous avions eu le système le plus avancé, mais je
I
veux
don't want to
dire
say we have the most
ce qui
advanced
suit.
system.
Mais je veux dire ce qui suit.
I want to say
Je
next.
pense que nous avons été l'un des pays de toute la région à
I think
avoir
we were one of
pris
the only one in the
des
region
décisions en matière de surveillance les plus tôt possible.
to make a decision to start surveilling everything the earliest.
Je me souviens même que les gens de l'OMS, quand
I
j'avais
remember-
décidé de faire des définitions de cas
C'est quoi l'OMS?
et,
Je sais pas au courant, c'est quoi l'OMS?
Organisation mondiale de la santé
So even before the World Health Organization
en
said
Haïti,
anything.
quand on avait pris des décisions pour prendre des décisions, ils s'y étaient imposés parce que ce n'était pas encore déclaré comme une
They were
épidémie,
hesitating.
comme une maladie d'importance sanitaire mondiale. Mais moi-même, en tant que responsable, j'avais dit que connaissant le système d'Haïti, nous avons un système
I said as
faible.
director, as responsible for the system in Haiti, that we should do something.
Nous devons
So
prendre des mesures. Nous
can
devons
I
prendre
pause just
des...
pause a second here? Pause a second.
Uh-huh.
Jacob, I do need you a little closer to your computer. It's
Okay.
just that sometimes when you overlap with your voices, because you're a little bit away, I can't make out the English of what you're saying. So,
Okay.
can we just therefore, in summary, what we're saying is that Haiti had, you can't say if Haiti had the best surveillance system, but you had a very robust monitoring system that had been put in place since the earthquake in 2010 that was able to be redeployed in the context of COVID to do the
Yes.
monitoring, for which
Yes.
you personally helped to set up the respiratory monitoring unit to monitor COVID cases even before the WHO declared a
Yes.
pandemic in Haiti.
Yes. I think that were the difference because we start early and we make some decision early. When we got our first case, we already had 3 months monitoring all infectious, all respiratory infectious disease in the country.
And
That
so
was
when you guys had early input in terms of the first case,
uh-huh.
because at that time nobody really had any clear guidance as to what should be done. Did
Yeah.
you guys do anything different in Haiti?
Yes. Qu'est-ce que nous avons fait
What we did.
sur la base de ce qui se passait en Chine,
Unlike in China,
sur la base des expériences que nous avons eues dans la surveillance des infections respiratoires aiguës,
what
nous
we had
avons,
from
nous
with
avons,
experience from respiratory infection surveillance,
nous avons adopté une définition de cas
we adopted a case definition.
et nous avons déterminé comment on allait faire la surveillance par rapport au
We
pays
determined how we were going to do surveillance
où sévissaient déjà des cas. Ça veut dire déjà on
based
surveillait
on
les
severity of the case.
la provenance des gens de tous les pays en fonction si le pays était déjà affecté ou pas.
And we were going to decide if the people in the country were affected or not and how the country was affected.
Et nous avons formé ou bien actualisé tout le système qu'on avait préalablement préparé pour pouvoir
We already had a
détecter
system in
les
place.
premiers cas de COVID ou bien de SARS-CoV-2 à l'époque, peu importe que ce soit un cas introduit ou bien un cas qui apparaîtrait de manière brusque. Et c'était
And it
ça.
didn't matter what kind of case it was, we were able to detect it because the system was in place already.
Et le laboratoire à ce moment-là était déjà prêt parce qu'on avait déjà eu l'aide de CDC et de l'Organisation mondiale de l'OMS pour pouvoir effectuer des tests dans le pays. Or, on était même
We already
un
had the
laboratoire
labs ready, and we
régional
had,
considéré
when
comme tel.
information came in either from the CDC or the WHO, we were able to act on those directives and prepare the labs and the tests to standardize it.
OK.
No, so let's start off with the first question then. In the early part of the pandemic, 2020, were you surprised by the fact that Haiti seemed to be coping much better than many other countries around?
I can say you many decision we was taking if other country was take them after we was the first in all decision we was taking that was take about according or I can say our vision of the situation at this moment because I remember when I saw for the first time at the RFE the first case we had in Wuhan, I went to the minister. I said, you know, this matter will take all the world. But in Haiti, we have our system is so weak. We have to be prepared. It's the best thing we can do to be prepared because if this matter arrive in Haiti in this condition we have now, that will be fatal for us. And I remember at this moment the minister, and then you have to start today to implement the thing you have to implement. In this day, we start to organize our vigilance system in the country. That was the our history.
And did they then implement lockdowns in Haiti?
Hein?
Lockdowns. If you can explain that,
Est-ce
Jacob.
qu'ils ont fait des fermetures des gens comme ils ont fait aux
Yes,
États-Unis et
yes,
Canada?
yes, yes, yes. We was the first in doing that. I can say, I can tell you. I remember if you go on Google, you can see a I think in December 22 or 23, something like that. A some flight from directly China to go to Haiti. It seems that was some people that wanted to avoid the epidemic in China, and they was seeing where they can go, and they arrived to Haiti. In person, we blocked this flight. We prohibited them to stay. We gave them carburant. We asked them to go back because we said we don't have. We was not again rest to receive some people like that because we didn't prepare it for the introduction of the virus in the country. That was before January 2020. That was
Wow.
in December.
So you guys were, yes.
Yes, and when we got the cases was
Increasing.
increasing in the country, we had we made a list. We put some country in red. What I can say in red.
Red list. I know it's a
Red
red list,
list,
travel
red
list.
list, red
Yeah.
list. There was the red list, and any people who was from a country who was in red list arriving in Haiti, we had to follow you at least for 15 days. We will let you go, or we will not still to follow you after 15
So tell me
days.
now, Patrick.
Uh-huh.
So that is impressive stuff. This is what so you
Uh-huh.
guys were on the ball, but
Uh-huh.
at some point the virus would get through and circulate through the population. Even with the best lockdown, the virus would continue to spread. This is what we learned subsequently. How is it?
Could you
Yes.
translate? Uh-huh.
Can you
À
explain?
un certain point, le virus est passé, puis ça a transmis entre des gens.
Comment?
Le virus s'est passé entre les gens après un certain temps.
Oui,
On
c'est
pouvait...
sûr, c'est sûr, c'est sûr.
Yeah.
Après un certain temps, c'est passé entre les gens et on a perdu le contrôle. Oui, c'est arrivé.
Yeah. So how did Haiti, when the virus started to spread, how did Haiti manage in terms of the hospitals?
Ok. Je ne sais pas si j'ai bien compris. Est-ce que vous pouvez
Alors,
traduire?
après que le virus est débarqué, puis c'était entre les gens et ça a été transmis, comment est-ce que les hôpitaux en Haïti ont géré ça?
Ok. Bon, je dois vous dire que on avait des centres spécifiques
We had
pour la
specific health
prise en
centers
charge des cas de COVID.
for dealing with COVID cases.
Et le centre avec la plus grande capacité qui a été mis
The biggest center
pour cette circonstance,
for this instance
pratiquement n'a jamais été utilisé.
was practically never used.
Parce qu'on n'a jamais atteint les chiffres qu'on espérait, parce que nous autres aussi, on
We
s'attendait.
never got the numbers we thought we would
On
get.
s'attendait qu'il allait y avoir des milliers de morts, des milliers
We thought there would be
cas
thousands of deaths.
en Haïti. Mais
In
à un
Haiti.
seul moment, on avait les principales institutions qui étaient remplies. Et je
But
me
the
souviens
main
comme
institutions
aujourd'hui,
were filled.
quand on a atteint notre premier pic
When we hit the first peak,
des cas, et nos institutions n'ont plus jamais.
Oops, lost. What was that last thing he said, Jacob?
he was just saying it cut out, but he was saying our institutions have never, and then it cut out.
I hope he hasn't lost power on his phone. So let's hope he'll jump back. So let's just get the summary there, because he seemed as though there was a peak and then it just kind of flattened. It didn't continue to expand in terms of the spread in Haiti.
Yeah, they never hit the numbers they thought they were going to hit for whatever reason. But we didn't get to that yet.
Yeah, so this is the first scientific question and the first flag that should have been picked up by the world is the fact that they never got decimated in the first wave. Think about it, Jacob. What logical reason do you think the scientific community could give for why they weren't interested in that?
Well, I would think, I mean, it's hard to say because there's a lot of factors, but maybe at a population level, I would guess something with maybe immunity. I'm not, I've never been, but you do hear about like poor health conditions, lack of sanitation. So like maybe that immunity, just general natural immunity, made their systems a little bit naturally stronger, and that was a factor. Maybe the fact that there's so much sunshine and open air, and that it's like an outdoor place with a heavy amount of sun. We know vitamin C and vitamin D are beneficial. Um, I'm not sure what else, like why there was the peak though, and then it never happened to be a problem is also interesting. I also wonder if maybe it's a cultural thing, like they just treated it like the flu and didn't go to the hospital, didn't report.
Yeah, these are very important questions. And I think that what I remember what was happening early in the pandemic when we were saying that, say, for instance, Africa didn't seem as though it was being particularly affected. The consistent response was it's because they're not measuring the numbers. Of course, lots of people are dying. Of course, lots of people are in hospital, or they are not taking them to the hospital and they're dying in the country, in the rural areas. And for me, I couldn't understand that logic, because I said that COVID doesn't kill you suddenly. Somebody needs to have respiratory compromise for sometimes 48 hours. And to imagine that a family would leave a loved one at home needing oxygen, not taking them, even trying to take them to the hospital, doesn't make sense to me. And
Right.
so, from my perspective, I had always thought that if the hospitals are not overwhelmed with COVID, it's not happening.
Maybe. But another thing I wonder about too is when people, they say in Haiti they didn't report. Port-au-Prince, I was curious. It has more than 25% of the population. So based on that, I think that's enough of a smaller subset to kind of have an idea what's going on, even if in the rural they're more affected and less likely maybe to report. But in Port-au-Prince, where you do have a good system and where all the major systems are, you see the same situation. So I'm not sure they can argue that.
Yeah, I agree. My point was that even if you argued that this was happening in rural areas, in a city of over 1 million people, Port-au-Prince, there is nowhere to hide bodies. You can't bury them in your backyard. You get, there is, if a lot of people were dying, it can't be hidden. And so if this was not occurring in Port-au-Prince, then it probably wasn't occurring at all. And so my question that I think history is going to ask us is, when we saw these outliers occurring, why was there not more interest from the epidemiologists? So say, for instance, I am sure based on that robust system that Haiti had, all of this data was being fed into the WHO. So the WHO would have known these numbers. Why was this not taken as a template for this is how you do it? This is a standard of practice that you follow? Is it just because they weren't a first world country? I don't know.
I mean, I would think so, because there's nothing else that can explain it. And then, even today, like you mentioned, they're just saying, oh, everybody died in the rural areas and nobody knew. But that would be kind of crazy, because I feel like you would have heard about it, and there were NGO workers over there at the time. I'm sure that would have been reported as well, because there's no way, everybody has a phone now, everybody has the internet. We would have heard if there were people, like you said, suffering and dying for 48 or whatever many hours out in the countryside. And I feel like those people, their families would have found a way to bring them into the city, or an NGO, like the NGOs, I feel like would have reported that.
Absolutely. Yes. And now when you add on to it the fact that Haiti had a robust monitoring system that they repurposed for COVID, you know that their data is accurate. And so this is the bit of information that I thought was so important to capture. I didn't know it was that robust, quite frankly. I was a little bit taken aback that they
Yeah.
had such a sophisticated monitoring system. And it just demonstrates more and more that the assumption that only one set, I think he's probably, I hope his battery isn't the problem, but we'll see if he can jump back in shortly. But yes, to think that simply because they're not a first world country, they can't have systems in place that would be able to handle this, I think is just purely arrogance, and this is the kind of arrogance, I think, that has caused the scientific community to make so many mistakes by presuming that the people who should know always know.
Yeah, I think there's definitely, especially with the people that are at the head of the WHO, so mainly the US and China, there's huge just arrogance and even blatant racism towards a third world country. And you keep hearing that over and over again when countries had, especially, less Western or poorer countries had better outcomes than Western countries. I think it's also maybe a little bit, it might be embarrassment that they did, those very harsh, very oppressive lockdowns, and they had far worse outcomes than, much poorer countries. So I think it's maybe just unwillingness to admit it.
Yes, one of the things that I'm hoping we get Patrick back is that the other part of the challenge that I want to explore is that issue about the vaccination status in Haiti. And he had mentioned previously that many people, especially the healthcare workers, refused to get vaccinated. And once that happened, you really are going to struggle to get the population to take the vaccine if your healthcare workers weren't taking it. So in that context, how they were able to get through even the Delta wave, so the Delta wave had some of the most serious outcomes, and that was in 2021. That was after the vaccine had been rolled out in first world countries, and some of the third world countries were only getting the dregs of a few vaccines. So the question then is, how did Haiti, in that context, manage to get there? Hi, Patrick, your mute is on.
Do you hear me now?
Yes,
Yeah,
wonderful.
so
We
yeah.
were just
I'm,
talking.
I'm
Uh-huh.
sorry because I'm using my phone. Some
Yes,
people was calling, and I was
disconnected.
not okay.
Okay,
Yes.
good. So listen, here is what we were saying, Patrick, is with those kinds of outcomes and that kind of monitoring that was occurring in Haiti at the time, because you were reporting directly to the WHO, they would have gotten all that data. Why was Haiti not used as a template for the world to follow in terms of outcomes, even early in the pandemic?
Est-ce que vous pouvez
Ouais, alors on disait que l'Haïti a bien fait, puis il n'y a pas eu un problème avec les cas. Tu as bien géré les cas. Et tu as donné ces données directement à l'OMS, le WHO. Alors, si le monde savait que Haïti gérait ça bien, pourquoi est-ce que t'as pas été utilisé comme exemple? Pourquoi plus de pays n'ont pas te regardé comme exemple et après d'Haïti?
Bon, on abuse. On avait même félicité Haïti pour sa prise en charge des premiers cas. Et peut-être que je devrais
We
chercher
had to make decisions about the first cases.
ces informations. L'OMS avait reconnu le travail qu'on avait fait, surtout dans
The
le domaine de la
WHO recognized our
surveillance.
work.
C'était le travail qu'on avait fait.
Mais comment est-ce que l'OMS, qu'est-ce qu'ils ont dit? Ils ont fait de quoi? Qu'est-ce qu'ils ont fait?
Bon, je devrais chercher dans les archives, mais je me souviens que on avait félicité Haïti des premières
We got a
des
congratulatory letter or
ah,
email from them.
I
peut-être je
just
dois
missed that
chercher
there, Jacob.
avec
Huh?
ça, mais ils avaient reconnu qu'on a très très bon travail. Et moi, je ne dis pas ça pour moi, mais j'en suis sûr que pour avant l'introduction de l'épidémie, en matière de surveillance, je peux vous dire tout ce que j'ai vu que les autres pays font après, nous autres, on les faisait déjà avant.
All right,
Some
so pause
countries, I
there,
can say some
Patrick.
countries copied us. I can say some
Yeah, go ahead.
countries copied us.
Some countries did copy Haiti because of
Non,
their
je ne dis pas
outcomes.
qu'ils ont copié, mais je vous dis que c'est après que même le Canada, des choses qui font au Canada, après, c'est des choses qu'on faisait après. Par exemple, nous autres, les interdictions, les mesures de barrière, ces choses-là, c'est des choses qu'on avait prises dès le début. Dès qu'on a eu le premier cas, on a fermé l'aéroport, etc. Et on avait pris beaucoup
Alors,
de décisions qui ont été même controversées.
pourquoi on peut pas dire que les autres pays ont copié si on l'a fait après?
I
Je
missed that
demande.
bit, Jacob.
I'm saying he's saying countries didn't necessarily copy, they did it afterwards. But I'm saying if they did it afterwards, didn't they copy?
Mm-hmm. So yeah, so other countries were then able to copy the strategies employed by Haiti, but they wouldn't have had the infrastructure in place. So I wanted to ask you, Patrick, and this time try and answer in English. When people say that a lot of people were probably dying in rural areas and not getting to hospital, this is why the numbers were so low in Haiti. Is that true?
No. I can say you, every people who had some difficulty to with COVID, they went to a center because we had some center in each department or in each province. And we didn't observe neither a more deaths in the country out of the hospital because we didn't we don't have only a surveillance system for COVID. That is a national surveillance system for all disease, all event, even initial event. And then if we had more deaths than habitually, our system will cap them. I don't know if you understand.
So meaning that even if people were dying from other things outside of
Yes.
COVID, you would
Yes.
still have seen it.
Yes, because they have to report inhabitual, or I can say, des cas inhabituels. S'il y a un excès de décès dans les communautés, parce que we
If
have
there's a
also
sudden spike in disease or
des
death in the
surveillances
community, we
à
have to
base
see it.
communautaire aussi.
Repeat
We
that
have
again,
also a
Jacob.
community level
Nous
year to
avons
year.
aussi une surveillance à base communautaire, même si ce n'est
We
pas
have a
reporté
community
dans les
surveillance
hôpitaux, au niveau des
at the
communautés,
hospitals as well,
avec les agents de santé communautaire, ces
with
décès
the
auraient
community health
été
agents and public health
reportés.
people.
Et
Yes.
on les
So
It's all
capterait dans
reported.
le système sûrement.
So in effect, there was a community reporting system that would pick up not just COVID, but any other death from any other condition. So you would always have seen the deaths anywhere in Haiti because
If
of the surveillance system.
si c'est un ensemble de décès qui dépasse ce qu'on a l'habitude de voir, c'est ce que je
If
veux
it
dire.
goes above usual levels, if we have a surge above average levels, then we can pick it up.
Yeah.
Wow. So listen, so Patrick, so this is very important stuff here. Now, one of the questions that we have been mulling over whilst you were lost temporarily is, what explanation could there be for why Haiti did so well even when the virus was spreading? Because I'm saying this because I understand the Caribbean. I understand, say, for instance, what happened in Jamaica is your neighbor. There were still a lot of people dying. And so it's not just the sunlight. You know, there has to be something else. Can you think of anything that is unique to Haiti that could explain this remarkable outcome?
There are a lot of things we can say. There are a lot of there are some I could say protector factors we had that can explain why our situation was different from another country. If you let me tell in French. The first time, dans un système comme Haïti,
In a system like Haiti,
où le système de santé est, je dirais, faible,
where we have a bit of a weak system, I'd say.
et beaucoup de gens qui devraient avoir une maladie chronique qui dirait spécialisée
A lot of people have a chronic disease that need a specialist
et qui n'ont pas de grands moyens
and don't have the means.
pour voir des spécialistes de manière, je dirais, avec leurs moyens. Ces gens-là n'existent pas, ils sont déjà morts.
We don't have them because they're already dead. You can't exist really with a chronic disease.
Parce que le système ne permet pas de les maintenir en vie comme au Canada, comme en France, comme ailleurs.
Like in Canada and France, you can't have people with chronic disease,
Je parle surtout des maladies chroniques que vous
especially
savez,
not chronic diseases.
qui rendent les gens plus vulnérables quand ils
That
attrapent
makes
le
them more
Covid.
vulnerable when they're sick.
OK. Ça, c'est un premier facteur. Ça veut dire que les gens qui ont des maladies chroniques, il n'y en a pas tellement comme dans les autres pays. Pour la raison que je viens de citer.
We don't have as much chronic disease like in other countries.
Deuxièmement, la population haïtienne, plus de 60% de la population haïtienne ont moins de 24 ans. Allez,
60% of the population is under 24.
c'est un facteur extrêmement important.
It's extremely important.
Si vous savez, et par exemple aussi, la majorité des Haïtiens, peu importe son niveau, ils vivent à l'air libre.
Ils vivent quoi?
À l'air libre, c'est-à-dire on passe la majorité de notre temps à respirer l'air naturel, le soleil.
The majority of Haitians spend their time
outside
in the open air, in the sunshine.
Et vous savez, vous connaissez l'importance de l'effet de l'environnement sur le virus et sur le mode de transmission. OK, ça c'est d'autres facteurs. Et autre facteur encore, on peut parler d'immunité croisée. Et bon, ça c'est des choses qu'il faudrait investiguer.
Des quoi croisés?
Immunité.
Ah, cross immunity.
Oui. Tout ça, pour moi, c'est des facteurs. Et puis, en Haïti aussi, la majorité des gens mangent. Nous avons une culture, et je dirais, primitive. Les gens mangent bio. C'est un facteur aussi. On n'a pas une agriculture comme les autres pays industrialisés où les gens mangent des choses. Mais tout ça, moi, quand je prends tout ça, c'est pour ça que j'ai dit que j'aurais bien aimé qu'on fasse une étude. C'est des facteurs qui sont, je dirais, des facteurs qui peuvent, si on met tout, on les étudie, on peut comprendre qu'ils ont eu un rôle dans le fait que nous n'avons pas eu autant de décès comme les autres pays.
I want to ask a question here, Patrick. I want to think carefully about this.
Mhm.
I understand the part about the younger population. I understand the part about chronic illness. But there are two illnesses that are very important in the context of COVID. One of them is hypertension, and the other one is diabetes.
Yes.
Are you saying that in Haiti, for both of those comorbidities,
Mhm.
that is very low across the population, or do you still have a significant proportion of the population affected by this?
We have a proportional effective, but I told, laisse-moi dire en français, je dis pas, nous pouvons avoir un nombre d'hypertendus et diabétiques proportionnel à la
We can have one
population.
proportional.
Nous pouvons l'avoir. Mais ce que je vous dis, notre système, et dans d'autres pays, on aurait pu avoir plus de personnes avec ces cas-là qui peut-être pourraient se trouver dans des étapes du développement de leur maladie un peu plus avancées. Mais que
In
le
other
système
countries, you can
n'aurait
get to a more advanced stage, but just our system in Haiti won't allow you to get to that level.
que le système n'aurait pas permis de les maintenir. C'est pour cela
We
que
can't
quand,
maintain you at that level.
quand les gens attrapent le COVID, peut-être ces gens-là qui auraient été les plus vulnérables, ok,
The
sont
most vulnerable people,
beaucoup moindres. Je ne dis pas qu'ils
much less.
n'existent pas, je dis sont beaucoup moindres par
There's
rapport
just less than
à
in other
d'autres
countries that
pays
are
pour
advanced
certaines de ces
comorbidity, like in
explications
other
que je viens
countries.
de vous dire.
Yeah. Now, I want to ask you a question here, Patrick, that I was very interested in. And I was very interested in the use of ivermectin across the population in Haiti. Okay. I know that there is a WHO program for lymphatic filariasis. Is ivermectin actually used quite broadly, or is it very concentrated in specific communities and locations?
Non, c'est localisé dans des spécifiques communautés.
It's localized in specific communities.
C'est par rapport à la mapification de là où on a plus de cas de filariose répertoriés.
It's
C'est
based
dans
on
des
how many
régions
cases we have.
Et c'est comme ça que ça se passe. Il y a des endroits qui sont moins concernés
It's like that
que
it goes.
d'autres par rapport à la distribution de la maladie dans le pays.
It depends how the disease is distributed.
And so there wasn't, say, for instance, in the US and across the world, when there was a lot of attention on ivermectin, was there a situation where the population was using it on their own, not necessarily with prescription?
Sorry, one more time for me.
So, you know that a lot of people, because they in Haiti, they would have heard probably about ivermectin and potential benefit in COVID. My question is whether or not the population would still have found ways to access it and use it. Would that have been known?
Après qu'on a entendu que l'ivermectin était bien pour le COVID, ça travaillait, puis on pouvait l'utiliser. Est-ce qu'il y aurait un moyen pour les gens à Haïti pour l'obtenir et l'utiliser pour personnel pour gérer le COVID?
Non. Non. Généralement, les gens qui ont pris des médicaments pour le COVID, ce sont des
Generally, people
gens
who took medications for
qui ont
COVID,
été hospitalisés. Mais
they were
dans les gens
hospitalized.
qui n'ont pas été hospitalisés, ils ont fait comment je dirais, ils ont fait leur thé, leurs choses comme ça, mais ce n'est pas des choses
They did natural remedies like
documentées.
tea.
Et ils ne prenaient pas de médicaments comme ça pour COVID.
They couldn't
C'est
take
des gens qui ont
medications
été
like that.
hospitalisés, qui ont eu un traitement, je dirais, adéquat et par rapport
They
à...
got an adequate treatment in the hospital, or they did their own thing at home.
And so tell me, what natural treatments were they broadly using in Haiti?
Bon, ça dépend de chacun de leurs croyances.
It depends on their belief.
Mais je sais que beaucoup utilisaient des mélanges où il y avait, je peux
Mixes.
citer, girofle, le thym,
Tea.
thym, girofle, l'ail, gingembre, cannelle,
Cinnamon,
euh,
ginger,
thym, girofle, gingembre, cannelle, l'ail, l'oignon, des choses comme ça.
onion. What? C'est quoi le
Et,
girofle?
et des clous de girofle.
Ah,
Les-
cloves.
yes,
Cloves.
Cloves.
yes. Mhm. Et thym,
Wow.
uh-huh. C'est des choses comme ça qu'ils utilisaient et bon, des choses qu'on connaît leurs propriétés anti-inflammatoires et dans la médecine traditionnelle.
Anti-inflammatory substances,
Uh-huh.
turmeric.
C'est des choses comme ça qu'ils utilisaient et des thés, mais euh, ouais, c'est des choses comme ça. Généralement,
It's
généralement.
things like that usually.
Beaucoup de gingembre.
A lot of
Wow.
ginger.
Listen, I mean, so can you imagine how much the world would have learned
Mhm.
by just exploring what in the world the Haitians were doing? Because this kept them out of hospital largely. I mean, the numbers according to the WHO were 837 COVID deaths. Is that about right?
Mais nous devrions questionner aussi
We have to ask also
les gens qui étaient dans la prise en charge pour savoir
the
exactement.
people that were in charge to
Je peux
see
pas
who was.
je me rappelle pas avec exactitude les, 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 les médicaments qu'on utilisait au sein des hôpitaux.
I don't
Parce
remember.
que il y avait un plan, dans le plan de prise en charge, il y avait aussi.
In the
Pause there for
plan
me,
for
Patrick. Yeah,
Mhm,
go ahead, Jacob. Just translate that for me.
mhm,
he was just saying about responsibility, but can you repeat your question and then I'll translate it again?
mhm,
Because I think we went on a tangent. What was your question again that you were asking? Why people didn't learn?
Well, I was saying that some of the outcomes that they were having, because we had about the WHO had 837 deaths out of
Mhm.
11 million
Okay,
people
is that
over the
accurate?
pandemic.
Exactly. Okay.
It was that
Um,
accurate.
alors, les chiffres de l'OMS disent qu'il y avait seulement euh, 8037 morts. Est-ce que c'est vrai? Est-ce que c'est précis?
Je suis certain que ça reflète la réalité pour toute la période de
I'm
l'épidémie.
certain that it's the reality for the country.
Wow. That could probably be the best outcome in the whole world, Patrick. I don't think any other country would have had a better outcome than what you guys had in Haiti. Now, the second part of the question is, what was the perspective in the population with regards to getting vaccinated? How did that play out when vaccines eventually came to Haiti?
J'ai compris, mais je vais me rassurer que j'ai bien compris. Traduisez pour
Ouais,
moi.
alors il demande quand l'Haïti a fait très bien dans le monde, peut-être le meilleur, quand on compare les morts à la population, mais on veut savoir c'était quoi l'attitude ou les pensées, les croyances des gens vers les vaccins quand le vaccin est sorti.
Bon, je dois vous dire que la population haïtienne, dans sa majorité, n'avait pas cru dans
Most of the
l'histoire de
population didn't
l'épidémie.
believe in vaccines.
Beaucoup même avaient pensé que c'était une politique du gouvernement
They
et
thought it was a
cette
political game.
histoire de COVID. C'est-à-dire, ils
The
n'accordaient
whole
pas
thing.
vraiment beaucoup d'importance à la maladie. C'est quand on a commencé à avoir des décès que
It's only when we
certains
started getting deaths that
ont
people actually
accepté
believed it.
que ce n'était pas de la politique.
That people
Et,
accepted that it wasn't a political game.
et pour cela, beaucoup d'entre eux n'avaient pas accepté l'idée de la vaccination.
Not many people
Non,
accepted
pas
the
accepté
idea of
le
vaccination.
vaccin. Mhm. Et c'est pour
What
ça
about
aussi
the
qu'on est l'un des pays à avoir le taux de vaccination le plus bas.
We
Parce
had the
que
lowest
beaucoup
vaccination
de
rate, or one
gens
of them.
n'ont pas accepté carrément. Et pour des questions
People
de
squarely
croyance aussi, vous
refused.
savez, c'est un peuple très, très croyant. Pour des questions de croyance aussi, ils ont pensé
It also goes back to
que le
beliefs.
vaccin n'était pas trop bon. Et c'était ça l'idée de tout
Yeah, the
de ce
vaccine
qu'on
was just a
dirait.
bad thing to do.
and
C'est,
so what
malheureusement,
about the
c'est notre réalité.
yeah,
It's our reality.
what about healthcare workers?
Non, je
Were
vous
they
disais
as
que Cette tendance-là,
This
même,
tendency.
même parmi certains, je ne dis pas parmi tous, parce que moi, je m'étais vacciné, je faisais toute mon équipe.
I was vaccinated. I did everything I
Mais
could to
je
protect
vous
myself.
disais que même chez certains personnels médicaux,
Even
on
among
n'acceptait pas,
providers and medical
n'acceptait pas
personnel,
de se faire vacciner.
there was many that refused.
C'était vraiment un grand défi pour nous autres du
It
ministère de
was a
la
big
Santé
challenge for
publique
us
de motiver les gens à se faire vacciner. C'était un grand défi.
to get people to get vaccinated, to motivate them to get vaccinated was a challenge.
So when we look at that, and this is one of the problems with regards to the current narrative globally, that vaccines have saved millions of lives across the world. But if that was accurate, how do you explain Haiti 2.7% vaccinated and the best global outcome in the world?
Il y a une chose que je veux vous dire.
There's one thing I want to tell you.
Peut-être on devrait faire une investigation pour
We need to
corroborer
make an
ça. Mais
investigation.
je pense, c'est une pensée, une hypothèse. Je
But I
pense
think, in my thoughts,
que beaucoup de gens ont été
a lot of people
infectés par le virus.
were affected by the virus,
Mais ils ont eu la forme légère, pas
but they got
sévère.
a light version of it.
Et après, peut-être ils ont développé une sorte d'immunité, je dirais, naturelle, parce qu'ils
They
ont
got a
été quand
natural
même
immunity to
en
it.
contact. À mon humble avis, beaucoup de personnes, ou bien la majorité, ont été affectées, mais ils n'ont pas eu la forme sévère qui
People were
exigeait
affected, but probably didn't even
qu'ils
know it
aillent à
and
l'hôpital
passed it on through contact.
chercher de l'aide. Ce que je vous dis, c'est un phénomène qu'on observe aussi avec la dengue en Haïti.
La quoi?
Par exemple, la dengue.
La dengue?
Fever dengue.
Oh,
Vous connaissez
dengue
la
fever.
Uh-huh.
Dengue fever.
C'est un phénomène pareil qu'on observe en Haïti.
It's a
La dengue
similar
fait
phenomenon that we observe in Haiti.
La dengue fait des épidémies toutes les années en République dominicaine, à
We have
Cuba,
outbreaks every
dans
few
les
years in different
Antilles.
places in the
Moi,
Dominican Republic.
je sais que les quatre sérotypes circulent en Haïti, mais on n'a
These types are in
pas
Haiti.
facilement enregistré des cas de dengue hémorragique. Pourquoi? Il faut étudier pour savoir. Mais dans la
But
région,
we
un
don't
peu
get a lot
partout,
of
il y en
hemorrhagic
a.
fever or dengue fever for some reason.
Pourquoi?
We have to investigate
Il faut
why.
étudier pour savoir. Mais
We have
on
to
n'a
figure out why.
pas eu d'histoire de dengue hémorragique. Peut-être
We don't
nous
have
avons
hemorrhagic fever in Haiti.
des facteurs protecteurs qu'on doit étudier pour les déterminer, mais je vous fais ces parallèles pour vous dire que c'est quelque chose de similaire, parce que nous autres, on était préparés à plus de
I'm making
60
this
millions,
parallel
on
to say it's
s'attendait à
similar.
Haïti.
We have similar
Mais ce n'était
phenomena
pas
in
le
other
cas.
places where we're less affected.
So can you, Patrick, explain or justify why there has not been more epidemiological research into the outcomes in Haiti
OK.
at this?
J'étais le coordonnateur du comité scientifique
I was the
pour,
coordinator of the scientific committee
pour le management de l'épidémie.
for epidemiology management.
Et il y avait des professeurs
There's professors
un peu partout qui faisaient partie de ce
from everywhere.
comité-là.
That were
Et dans
part
ce
of the committee.
comité-là, c'était un comité mixte formé de différents techniciens de différentes disciplines, anthropologues,
Had technicians in different
sociologues,
disciplines from everywhere.
sociologues, etc.
Sociologists, epidemiologists.
On a élaboré des protocoles d'études pour répondre à
We
ces
made
questions-là.
protocols and studies.
Et il y a d'autres institutions qui
Other
voulaient, mais
institutions.
en Haïti, la recherche, c'est pas, et je dirais, c'est pas, comment je pourrais dire ça? Bon, malheureusement, c'est pas, on n'a pas toujours des financements pour
We
réaliser
don't
des
always have
recherches.
the money
Généralement,
to do these
on
studies.
doit dépendre d'un bailleur, ce volet-là, et
We need buyers or external funders
pouvoir
to support it.
réaliser des études importantes. Mais c'est
We have
financement.
important studies to do,
On n'a
just not
pas
the
fait
funding.
des études pour répondre à beaucoup de ces interrogations-là. Personnellement,
There's a
fait
lot of studies that need to be done to answer these questions.
les financements qu'il fallait, moi, je serai en mesure de vous répondre à toutes ces questions-là aujourd'hui. Parce que même pour même pour les, 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 les lacunes que nous avons, nous travaillons très close avec CDC. On pourrait s'appuyer même pour faire des tests que nous ne pouvons pas réaliser
We can do more. We just don't have the means to do it, but we have the infrastructure and the laboratories to do it.
Pour
Wow.
faire les recherches qu'on devrait faire pour répondre à certaines interrogations. Mais c'est pas la priorité de beaucoup. Et nous
And it's just not a
nous sommes des
priority for a lot of
techniciens,
people.
mais c'est pas nous qui mettons les fonds pour les réaliser. Et c'est ça la réponse.
Yeah, the funds have to be allocated to other places, and it's just not a priority.
Wow. I'll tell you what, this is the lesson that I have learned from observing the pandemic is that I don't follow experts. I follow outcomes. I don't care what anybody says or what credentials anybody says. If you have the outcomes, you are the expert. Does that make sense?
I can tell you, if somebody don't cry that our outcome are true, they can make some investigation after they call me. Because I'm sure that our outcome reflect the reality we had in Haiti. I'm sure of that. I can't say
Absolutely.
that was exclusive, but I'm sure that was the comportment we had of the epidemic in Haiti. I'm sure. Because
Wow.
our expectation was, if you go to the Google, you will see we was expected to more than the 60,000 deaths.
60,000 deaths.
We expected. Been seen when we never, on n'a jamais atteint même après le pic, autant de beaucoup de décès. C'était vraiment très
We were
très bas.
expecting
Et
many deaths, and we
parallèlement
didn't
à
get
la
it.
République dominicaine, parallèlement à d'autres pays, c'était vraiment vraiment bas.
Especially when you compare us to other countries, it was very, very low.
Je ne dis pas que nous avons capté exclusivement tous les cas. Je ne dis pas ça.
We probably didn't capture all cases. I'm not saying that.
Mais je peux dire que nous avons capté la majorité des cas et ce que nous avons donné reflète la réalité. La vraie dynamique, c'est ça.
And our numbers reflect reality.
Et je ne crois pas qu'il y ait un pays qui ait capté la totalité de tous les cas. Je ne crois pas.
I don't think any country captured the totality of it.
Yes, I agree. Listen, so Patrick, what I want you to do is that as we close out, actually, before Patrick says anything, because I want Patrick to have the last word, I want you, Jacob, to give a thought. What, based on what you've heard here, what are your thoughts? And then I'll ask Patrick to close out with his thoughts and to give us his vision for what he wants to go forward.
So I think from this, there's definitely something to be learned from these community systems. That's really interesting. I know, like I grew up in Canada. Rural medicine is always a challenge. So I think putting in similar systems and having similar systems in place and maybe developing more the rural is important. I also think that, RCTs with some of the natural remedies that he mentioned would be super interesting. And then also looking at the effect that the outdoors and the sunshine, I'm not sure how you would set up an RCT for that. It would be really interesting, but yeah, I think just RCTs for everything, and then just being, I guess, less ignorant or dismissive of so-called poor countries.
Excellent. Yes, completely agree. And so, Patrick, what I want you to do is I want you to, you have to do this in English now. So say your vision as to what it is that you would want to come out of this for Haiti, and what is it that your vision is for yourself as you continue your professional career in Canada.
Um, could you translate? It's possible.
Yes. So,
Alors, oh, yeah, I got it. En anglais,
Mhm.
il veut que vous disiez c'est quoi, après ces données, après qu'on a ces informations, qu'est-ce que tu veux dire ou c'est quoi la vision pour la future pour l'Haïti et aussi pour vous, pour votre carrière à Canada?
Ah, il veut que je dise ça en anglais.
Ouais.
Ah, okay. Um, I have to let you know that I really would like to still working in Haiti because I understand that I was doing a good job, an important job for the country, and they only need some people like me there. But because the reality we have now, the insecurity, my home was invaded by gangster. I went. I am working out of Haiti since 2022. That was the reason I went to Madagascar. I work with the Ministry of Health there, with CDC also, to strengthen the Ministry of Health in surveillance system with the FETP, Field Epidemiology Training Program of Madagascar. Now I'm in Canada. I just arrived, like I told you. I don't know what will be happen. I only know I can't go now to Haiti. If that was possible, I would go to work in Haiti. But if I can find some people in Canada who interest with investigation with Haiti, I would like to be involved in give my experience there. If I can bring some experiences I had there for more than 10 years about our surveillance system, I think that will be very good. For the moment I'm here, I don't know exactly what will be happen because I just arrived. But that is my situation now. Uh, I can resume to say if the situation is resolved there, I would like to come back. But now I can't. Now I am here. I don't know exactly what will be happen. I'm expected with any opportunity I can find. That is all. Mhm.
wonderful, wonderful. Listen, Patrick,
Mhm.
as I said, my hope is that this kind of video is seen by everybody in terms of people who are interested in the science around COVID.
Mhm.
What you have demonstrated here is a level of expertise with managing this kind of pandemic or an epidemic situation using the resources, limited resources, to get what I think, based on the numbers, are potentially the absolute, by far, best COVID outcomes in the world.
Yes, I think so.
And so, what we have here is that from an outcome based perspective,
Mhm.
you are the expert.
Mhm.
There is nobody else who would be able to say that they had anything near those kind of outcomes. And it is a disappointment that our leadership, even after they have seen the failures that they have been involved in, will still not make sure that the people who actually did the hard work, got the best
Yes, yes,
outcomes,
yes,
are
yes.
not in positions to lead and guide us into the future. For me, that is the most important change that needs to happen now, expertise is not about credentials, it's about outcomes.
Yes, and I can tell you for having those outcome in the time of COVID, I was sleeping at least 1 or 2 hours by day, because all my team we work truly hardly to get those information, and that was
One.
national. Mhm. Yes.
Wonderful, wonderful. As I said, Patrick, really appreciate you taking the time to come and talk to us and share these experiences. Jacob, we had, without you here to help us with the French, English, I don't think we would have gotten as much information. But yes, I really do hope that this video will serve as a repository for future generations as to how and what happened in terms of the country with potentially the best COVID outcomes.
I don't know if they will understand my English, but
Yeah, it's fine.
It's fine. Don't worry.
I
I will
try.
make sure it will take me some time, but
I'm
I
better
will try my
writing than
best to make
speaking.
sure it's captioned. Yes. So thank you.